Dr. Greeny here. I'm a skin doctor, and today we're going to talk about hair loss, a very common and stigmatizing disorder that can happen to men and women alike. I'm going to talk about the latest and greatest treatments in 2021, so here we go. There are a ton of different reasons that people lose hair, so it's always a good idea to see a board-certified dermatologist to make sure to get an accurate diagnosis and the best treatment recommendations for you. I'm here every week to get you your best skin, so make sure to click subscribe and turn on notifications so you don't miss any great skincare videos. Now, I know there's something that's kind of funny about a guy with not such a great hairline giving hair care advice, but these tips can really help you. And if it comes to it, I'll probably shave my head. How do you think I look with a shaved head? Why don't you comment below? So we're gonna take it right to the space age and talk about low-level light therapy. This looks like a space helmet, or some other devices look like a comb. This delivers red light through a series of LEDs in the device. This has been studied in people and shown to increase hair follicle density and thickness. It's unclear exactly why it works, but some people think it is due to anti-inflammatory effects or possibly an increase in the cell cycle, which makes hairs grow faster. Red light does make sense for this because red light penetrates our skin deeper, so it has a better chance of reaching the hair follicle and working where it needs to. One of the devices that's FDA clear is called the iRestore device, and it does look like a helmet. You have to use it for over 20 weeks to start seeing results, and it costs you about $500. But it is cleared by the FDA to work for hair loss. Next up is PRP, or Platelet-Rich Plasma. It's a fairly quick treatment that can be done in your doctor's office. It usually takes a series of treatments. Most people will buy a package of 3 or 4 of these treatments. The idea of PRP is to harness the growth factors that are in our blood and inject it to the areas of hair loss to stimulate hair growth. What happens is you go to your doctor, they draw your own blood, they put it in a thing called a centrifuge, and they separate the plasma from the red blood cells. In the plasma, there are the growth factors that are concentrated. This can be drawn up into syringes and actually injected throughout the scalp to stimulate hair growth. The science still isn't totally clear, but in studies where they use placebo on one side of the scalp and PRP on the other, the PRP side did have increased hair density after a series of 3 treatments. Oftentimes, the treatments that cost anywhere from $1,500 to $3,000. After a series of 3 or 4 treatments, patients often come back into the office a few times a year for repeat maintenance therapy. So we've talked about medical devices and we've talked about PRP, but I want to tell you guys a little bit about some topical options for hair loss. One of the most exciting new options in 2021 is Topical Finasteride. Now, this has been approved recently for acne for people, but it's going to be interesting to see how that prescription does for hair loss. Finasteride is a medicine that inhibits an enzyme called 5-alpha reductase. This prevents the formation of dihydroxytestosterone from testosterone. Interestingly enough, dihydroxytestosterone causes us to lose our hair on our scalp, but to grow beards, chest hair, and things like that. Again, this treatment is fairly new, so it'll be interesting to see how things go in the future. Another treatment that's been around for a while, but still is one of the most effective treatments, is topical minoxidil. Minoxidil was originally a blood pressure medicine, but it does happen to regrow hair and prevent hair loss. It works by switching hairs from resting phase into growth phase, and it also enlarges miniaturized follicles, or baby hairs. It's not exactly clear why it works. It's science. You can find minoxidil in solutions and foams. A lot of them are labeled men's or women's. That doesn't matter. What you want to look for is the percentage. A 5% solution or foam will work better than a 2%. So there are some myths surrounding minoxidil. A lot of people think that once you start it, you have to continue doing it or you'll lose more hair than you had lost before. This is not true. However, you will lose the benefit of the minoxidil if you stop it, which makes sense. Meaning the hair that you gained from the minoxidil or kept, then you'll lose that over a period of time. The most common things with the topical minoxidil are irritation or sometimes scaling of the scalp. In some people, they get what's called hypertrochosis. This is when extra hairs form in areas where they shouldn't, maybe on the tops of the ears or sometimes on the forehead. I always tell patients about this risk, but it's rare for a patient to stop for this reason. It'll take at least 4 months to see response from topical minoxidil, but the best results are noticed at 1 year. For women using topical minoxidil, it's important to apply it a couple hours before bed to prevent the chance of spreading the solution from their scalp to other areas of the face. If you buy brand name Rogaine, this stuff can be pretty expensive, but you can actually find affordable generic versions like the Kirkland brand, where you can get a supply for 1 year for about 50 bucks. One of the common mistakes that people make is applying the solution to their hair and not their scalp. This is a scalp treatment. The solution must go on your scalp for it to work. Now, while minoxidil is an older therapy, it's one of the most proven therapies for hair loss. New things in 2021 include trying to change the way we deliver this drug. Now, doctors and scientists are working on other delivery mechanisms, such as microneedling the scalp, then applying the minoxidil, or using a cosmetic laser to punch holes in the scalp and delivering the medicine. I wouldn't recommend these things at home, but it's worth talking to your dermatologist about. These new delivery mechanisms are all about getting the drug to the area it needs to work in the hair follicle. So minoxidil is available over the counter, and I'm going to tell you about another thing that's available over the counter that you potentially could start today. It goes by the brand name of Nizoral. It is Ketoconazole 1% shampoo. It's actually an antifungal shampoo that's used for dandruff, but it has mild anti-androgen effects that may help stimulate hair growth. In studies after 6 months of use of Ketoconazole shampoo, people did see an increase in hair density. And the best news about that is it's only 15 bucks. You can use it a few times a week, and when you do, leave it on your scalp for about 3 to 5 minutes before rinsing. Not only will you not have any flaky hair, but you also may have increased hair thickness. Now we're going to switch over to talking about some oral treatment recommendations for hair loss. Now the first one is only available for women, and it's called Spirolactone. Spirolactone is an aldosterone antagonist. This means that it blocks testosterone synthesis and also blocks testosterone receptors in the hair follicle. Around 45% of women that have been on this medication do experience hair regrowth. Since it is an oral medication, it can have systemic side effects. The side effects that I tend to counsel patients on are breast tenderness, menstrual irregularities, and muscle cramps. Since testosterone does play a role in sex drive in both men and women, also decreased sex drive has been reported. Remember the finasteride that we talked about that could be applied to the scalp? Well, it also comes in a pill. This has been used in men and women for many years. Most commonly, people take 1 milligram a day, and this is a prescription medicine that you have to get from your doctor. The great news is that 2/3 of people do experience hair growth that are taking finasteride. A stronger version that can be used in women is called dutasteride, and it actually blocks both types of DHT receptors in the hair. In men taking this medication, there have been reports of sexual dysfunction while on the medicine. A lot of these people also had trouble with anxiety and depression, and it's not exactly clear that there's a direct relationship with sexual dysfunction. And the minoxidil or Rogaine also comes as a pill. Again, this used to be used as a blood pressure medicine, but it can be used at much lower doses for hair loss. The same side effect, hypertrochosis or excess hair growth in other places, can occur and is fairly common when taking oral minoxidil. But once again, patients that are on this that experience hair regrowth usually don't stop because of the hypertrichosis. While the blood pressure at these low doses isn't commonly a problem, some people get some leg swelling when using oral minoxidil for hair loss. Now the next treatment has come a long way, and that's hair transplant. It's a more invasive and more expensive procedure than some of the other things we've talked about. In the past, a strip of hair would have to be removed from the back of the scalp, and then when that strip was removed, it would be repaired. This would leave a line scar on the scalp. This usually wasn't a problem, but it would be an issue for people that wanted to wear a short hairstyle and the scar may be evident. Hair follicle units are then extracted from the strip of skin and then implanted in the area of hair loss. Now there are new types of follicular unit extraction where you can actually take out hairs bit by bit and not leave a big line scar. Transplants can take anywhere from 5 to 8 hours, and anywhere from 1,000 to 6,000 hair grafts can be implanted at one time. So oftentimes it's best to attack hair loss from multiple angles. So even those with hair transplants often use some of the other treatments that we talked about today to maintain their hair growth. I hope this review of all the treatments available for hair loss in 2021 was helpful to you. I'd love to answer your other hair questions or skin questions in the comments below. Many of the treatments I mentioned today, like the low-level light therapy, Ketoconazole shampoo, and topical minoxidil, you could start today. I'll make sure to link the products in the description below if you want to check them out. Thanks for watching. I'm always here to help you get your best skin, and we'll see you next week.